cause analysis. When a sentinel event or adverse event take place, it is important that we gather the facts. One form of investigation is a root cause analysis. This can be seen as one of the first steps in improving patient safety. Once the investigation has taken place, we can track where the errors of deficiencies occurred and then implement ways of improving the system so that the event does not reoccur. RCA is a cultural change tool. Root cause analysis is a tool for identifying prevention strategies. It is a process that is part of the effort to build a culture of safety and move beyond the culture of blame. RCA is based on the premise that people do not come to work to do a bad job or make an error, but given the right set of circumstances, any one of us can make a mistake. It forces us to look past the easy answer that it was someone else's fault, to answer the tougher question as to why the error occurred. There is seldom a single reason. It includes identification of the root and contributing factors, determination of risk reduction strategies, and development of action plans and evaluation methods. By identifying and addressing the root causes of specific adverse events, we will be able to have a better understanding of system errors and ultimately a safer healthcare. Root cause analysis is interdisciplinary, involving experts from the front line services. It involves those who are the most familiar with the situation. It continually digs deeper by asking why at each level of cause and effect. It identifies changes that need to be made to systems and is impartial in order to make clear the need to be aware and sensitive to potential conflicts of interest. Basic and contributing causes are discovered in a process similar to diagnosis of disease, with the goal always in mind of preventing reoccurrence. You should have a standardized process for each incident adverse event. Time is needed to do an RCA. The intent is to make sure that this tool fits into your system of quality improvement. The goal of RCA is to find out what happened, why did it happen, and why. What can you do to prevent it from happening again? Some reasons why errors occur. System factors. The work environment in healthcare is complex. Human factors. If an adverse event occurs, 70 to 80% of the time there is a human factor involved. We need to apply knowledge about human factors to the development of systems, interfaces, and work environments. Many errors, example diagnostic errors, are largely cognitive errors. System factors include complexity of healthcare processes, complexity of healthcare work environments, lack of consistent administration practices, deferred maintenance, and clumsy technology. Human factors include limited knowledge, poor application of knowledge, fatigue, suboptimal teamwork, attention distraction, inadequate training, reliance on memory, and poor handwriting.